What you need to know about migraine and high blood pressure. The recurrence of migraine headaches is sometimes an indicator that a person has excessive blood pressure. The following is a guide that will help you determine whether or not your headaches are caused by high blood pressure. What does it mean to have high blood pressure? The force exerted by the body's blood on the walls of its blood arteries as the blood is pushed through the body by the heart is referred to as blood pressure. It is expressed as a ratio of two numbers, such as 120/80. The first number represents the systolic pressure, which is the high pressure that occurs when the heart is contracting at its most forceful point. The second number represents the diastolic pressure, which occurs at the point in the heartbeat when the heart is relaxed. We talk about high blood pressure, often known as hypertension, since it can raise our chance of developing some dangerous diseases, and it can also be a warning that something isn't quite right with the body. Although the suggested threshold for therapy may be lower in at-risk persons, and health authority standards can alter in line with new data, the standard definition of high blood pressure is anything with a reading that is greater than 140/90. Problems with one's head and one's blood pressure. The majority of people who have high blood pressure are unaware that they have it until it is detected during a visit to a doctor or other healthcare practitioner. Certain individuals, on the other hand, do exhibit some symptoms that are associated with hypertension, particularly when their blood pressure reaches extremely high and sometimes dangerously high levels. There has been a great deal of investigation on whether or not high blood pressure is linked to headaches or migraines. However, the findings have not led to a great deal of conclusive evidence. The majority of people who suffer from migraines and headaches do not appear to have any changes in their blood pressure that are connected. And the majority of people who suffer from high blood pressure do not suffer from migraines that correlate consistently with their blood pressure. There is a correlation, according to the findings of certain studies, between migraines and lower systolic blood pressure but greater diastolic blood pressure. A connection between migraines and low blood pressure has been discovered in a few studies. Migraines also appears to occur more frequently in persons who have persistent high blood pressure that is not managed properly, if the research is to be believed. One of the most common symptoms that people with high blood pressure report experiencing is headaches. High blood pressure is one of the leading causes of these symptoms. What does it feel like when you have a headache because of your high blood pressure? Pain in the head that is caused by high blood pressure is frequently characterized as being pounding, tight, or thumping, and it is occasionally accompanied by an aura that is similar to that of a migraine. When excessively high blood pressure is the underlying cause of a headache or migraine, the sufferer may also experience other symptoms, including confusion, nausea, chest pain, as well as emotions of fear and panic. Migraines can cause headaches of a very severe nature, and those who suffer from them frequently experience what is known as an aura, which are feelings or shifts in vision that come on before the more common symptoms. People who suffer from migraines often report seeing flashing lights, being sensitive to light and sound, feeling nauseous, and nauseated. Migraines are distinct from headaches in that, in addition to more localized pain in the head, they are more likely to be accompanied by other symptoms, such as disturbances in vision and hearing as well as other sections of the body. People often say that the agony of migraines is worse than that of most headaches, even though a headache's severity can vary greatly from person to person. Is it possible for migraines to be caused by high blood pressure, or might high blood pressure be caused by migraines? However, a hypertensive crisis, which is an abrupt form of dangerously high blood pressure, can have substantial symptoms. Normal elevated blood pressure, on the other hand, does not create any symptoms. Although high blood pressure can cause migraines in certain people, the connection between the two conditions is not as straightforward as one might think. There is a possibility that migraines and hypertension share the same root cause. When a person is sick, under a lot of stress, or sad, when they are reacting to dietary intolerances, when they are engaging in unexpected vigorous exercise, or for any number of other reasons, they are more prone to suffer from migraines or high blood pressure. Because of this, migraines and high blood pressure have the same fundamental reason for their occurrence, which means that they can sometimes occur simultaneously. Because a person's blood pressure can be raised when they are unwell, under stress, or for a variety of other reasons, A person who is experiencing a migraine, which is an intense episode of pain and other unpleasant symptoms, could have raised blood pressure as a result of having raised blood pressure. People who report having the type of migraine that comes with an aura people typically describe flashing lights and similar symptoms before a migraine are at a slightly elevated risk of cardiovascular disease. This risk is not significant, but it does exist. People who suffer from migraines should be aware of their risk of cardiovascular disease and should try to manage their other risk factors as best they can because of this link, even though the processes underlying this connection are not completely known. It is not entirely understood why some people are susceptible to migraines while others are not. However, we do know that the symptoms of a migraine are brought on by shifts in brain activity that affect blood vessels, nerves, and chemical signals. There is a strong physiological connection between migraines and the vascular system, which includes the blood vessels that support the brain. Blood pressure affects the vascular system, which includes the blood vessels that support the brain. Managing migraines at home. People who suffer from migraines consistently, headaches that occur frequently, or migraines that are difficult to control should consult their physician. To rule out any potential links with high blood pressure that needs to be addressed, the doctor should examine both of their blood pressures at the same time. Some people who have migraines discover that they can identify the triggers for their condition. Some people have migraines after eating certain foods, during hormonal changes, when they are sick, when they are stressed, or when they are anxious. The ability to recognize and cope with these triggers, or at the very least, to anticipate the likelihood of experiencing a migraine, can be helpful in the management of migraines. Managing a migraine attack is also a very personal process. Many people find that going to sleep or being in a dark room can be helpful during an attack of migraines. When the first signs of migraine appear, taking a mild pain reliever like paracetamol can help to lessen the severity of the headache for the duration of the migraine. If simple home management of migraines isn't helping, or if your headaches are frequent and severe enough to influence your day-to-day life, a doctor may recommend more in-depth investigations or harsher therapy for migraines. If this is the case, simple home management of migraines isn't working. Anti-nausea medicine may also be provided to patients who experience a significant amount of nausea and vomiting as a side effect of their condition. When you should see a physician. Make an appointment to visit a specialist if you experience headaches or discomfort that last for more than a few days and are not relieved by treatments you can perform at home. Anyone who measures their blood pressure at home and discovers that it is frequently higher than the suggested limits or that it is occasionally significantly higher than the recommended limits should schedule an appointment with their primary care physician as soon as possible. You must get your blood pressure checked regularly and see a chronic illness clinic if you have other health issues that put you at a higher risk of developing high blood pressure, or if you already have it. It is vital to see a physician regarding one's lifestyle, management, and treatment options. If you like this video, follow us and you will find many videos that will help you to transform your life. Thanks for watching all the video. Please subscribe and hit the bell. See you soon.